Hello. So our group is going to be talking about how TMJ disorders and its related complications affect health, function, and sleep. Our group consists of Kenny Tran, John Park, and Cecil Cray.
Imagine taking a big bite of a beautiful, juicy apple, and all of a sudden, your jaw completely locks up. I know that sounds crazy, but that is the reality for more than 10 million Americans who suffer from temporal mandibular joint disorder. Temporal mandibular joint disorder, or commonly referred to as TMJ disorder or TMD, is a condition that affects the jaw joint and the muscles that control the jaw. These conditions usually occur in any combination of the following: muscle pain, internal joint derangement, and arthritis. TMJ disorders typically peak between the ages of 20 and 40 years old. TMJ disorder has a slight female predilection. It is not only responsible for orofacial pain, but also a variety of problems such as attrition and abfraction, which we covered in this class, as well as sleep deprivation. TMD is a very common disorder, and 25% of the population will at one point in their lives suffer from it. So dentists will routinely encounter patients with TMD, and it is important for them to understand how it can negatively affect their patient's quality of life. These patients can suffer from radiating pain in their face, jaw, or neck. They can have really bad muscle stiffness of their jaws to the point the jaw just locks up, as I mentioned earlier. They can also have very painful clicking of the jaw whenever they open or close their mouth. But John will discuss more about TMD symptoms in a little bit. So again, it is very important that dentists understand their patients that suffer from TMJ disorders. Also, remember how important and how often we use our mouth every day. We have to eat, talk, and communicate by using our mouth. By presenting on this topic, we believe our peers will benefit through better understanding of the disorder and how to help maintain oral facial health.
Alright, so I'm going to be talking to you about TMJD manifestations. So there's a wide list of symptoms that can display in a person with TMJD, and they can affect either one or both sides of the face. The manifestations include radiating pain in the face, jaw or the neck, jaw muscle stiffness, limited movement or locking of the jaw, and a change in the way the upper and lower teeth fit together. If we talk more about the manifestations of TMJD, they can also include earache and/or headache, biting or chewing difficulty or discomfort, clicking, popping, or grating in the jaw joint when opening or closing the mouth. And it's also important to note that if there isn't pain associated with the clicking or popping sounds, it's likely that you wouldn't need treatment for TMJ disorder just because it wouldn't be necessarily as severe as one with pain. Now, if we talk about the manifestations, there has to be causes behind them, and there's a variety of different causes. But since symptoms can widely vary, it depends on the severity. It can be due to a combination of factors such as genetics, arthritis, or jaw injury. Other possible causes could include poor posture, and that's because it can cause strain in the face and neck muscles. And surprisingly, when I was looking this up, it was interesting to note that TMJ actually tends to be more common in women than men. So research is currently being done to see if there's a link between female hormones and TMJ.
Hello, my name is Kenny Tran, and I'm going to be talking about TMJ imaging. There are three main types of TMJ imaging, and they consist of panoramic radiographs, MRIs, and cone beam CTs. For initial diagnosis of the TMJ disorder, we often use panoramic radiographs. It is used for initial evaluation. It has limited reliability, though, in detecting bony lesions. However, we can see slight degradation of the condyle, misalignment of the mandible, and flattening of the condyle, which are early signs of TMJ. A more common diagnostic technique for TMJ disorders is the MRI. This allows us to see the disc and the soft tissues of the joint. It also allows us to determine the disc position, and the imaging is useful for determining degenerative changes and condylar movement. In this example, we can see the difference between a normal left TMJ and a diseased right TMJ. We see the disc in the deranged in the open stage and the closed stage, and the differences in a diseased and normal TMJ. Cone beam CT is also used sometimes for TMJ disorder diagnosis, but it only allows us to see a higher detail of bone density and the location of the bone, which is useful for determining arthritis, but it gives us a very limited view of the soft tissue and disc, which is more important to diagnose TMJ disorders. There are various complications associated with the TMJ disorder. We see pain from closing with the masseter, anterior, and middle temporalis muscle, the medial pterygoid, and the superior lateral pterygoid. We also see pain from opening that is isolated to the inferior head of the lateral pterygoid, the anterior digastric, and the mylohyoid. We often see headaches due to this interaction with the muscles, and sometimes we also see changes in dentition to bruxism caused by the jaw dysfunction. Additionally, the disc can be deranged, and this derangement can sometimes lead to complete destruction of the disc, which may need surgical measures to treat. Arthritis is also a major complication with TMJ disorders. If the disc is anteriorly deranged or posteriorly deranged, we can have bone-on-bone action with the condyle and the mandibular fossa, which is significantly a sign of arthritis.
Now, for the treatment options for TMJ, it's often recommended that you do simpler, less drastic treatments to see how the condition will respond. And this is because a more aggressive approach has the potential for causing a permanent change in the structure and/or position of the teeth and jaw. Now, when you're looking into conservative treatment, there's different ways you can go about it, and you have a wide variety of options available to you. So it can be either physical or medication-based. When you're talking about the physical ways of treating TMJ, these can include eating softer foods to relieve joint inflammation, therapeutic techniques to help massage, relax, and stretch the jaw muscles, moist heat or cold packs directly applied to the face, jaw exercises, and so on and so forth. Now, in terms of medications, you can use specific ones such as pain relievers, such as ibuprofen or NSAIDs, which are short for non-steroid anti-inflammatory drugs. You can also use muscle relaxants to help relieve jaw tension. And then tricyclic antidepressants are usually used for depression, but surprisingly, you can also use them in small doses for pain relief for the jaw. Moving on to therapies available for TMJ, there are devices available such as stabilization splints, also known as bite guards, that can help provide relief. However, these are meant only to be used short term. In addition, another effective therapy is just education on behaviors that can aggravate a patient's condition, such as nail biting or jaw clenching. People tend to do these things without even realizing it, so if you can educate them on how to manage these behaviors or even prevent them, then that could greatly help relieve the symptoms of TMJ. Now, the final way of treating TMJ is surgical or aggressive treatment, but it's really meant more as a last resort since they can alter the bite pattern or the positioning of the teeth in the jaw. Their effectiveness is not entirely known. Now, there's three different ways that I found that you can treat TMJ through surgical or aggressive ways. So the first one is arthrocentesis, which is basically where small needles are inserted into the joint to irrigate it with fluid. This helps remove debris or other inflammatory chemicals. You can also do modified condylotomy, which is a surgery on the mandible, not the joint itself. It's meant to help with lockjaw and or pain. And the final way that I found that you can use aggressive treatment for TMJ is through joint surgery. It's also known as arthrotomy, and it's meant to repair or replace the joint in question due to structural problems. But the problem with this type of surgery, again, as with the other ones, is that there's more risk involved than the other options. So if you're going to treat TMJ, it's just usually better to be more conservative than aggressive.
So I'm going to talk about clinical outcomes. For clinical outcomes, we found that conservative treatment works. In 2015, a study was done at a Nigerian teaching hospital. Researchers interviewed patients who presented TMJ pain. The patients were asked to rate their pain level using a visual analog scale, or VAS. The VAS is a graduated meter rule that ranges from 0, meaning no pain, to 10, which is the highest level of pain. After 6 weeks of conservative treatment, which included medications and physiotherapy, none of the 401 participants had a VAS score of higher than 3. And as you can see from the chart, the pain levels were high during the first few visits, but they significantly decreased during the second visit and then decreased more during the third visit. You can see the number of patients with a score of 0 increased quite a bit during the third visit, which is here. One interesting note from this study was that the left joint was more frequently affected. I also wanted to note that we found a 2017 study that showed that conventional acupuncture therapy was also very effective in reducing the degree of pain, especially myofascial or jaw muscle pain symptoms as well. So as common as TMJ cases are, you would think that there would be more treatments available, but that's just not the case. However, biomedical engineers from the University of California have been working on future treatments. In March of this year, they published an article which introduced new approaches to treating TMJ disorders. The most notable treatment involved using tissue engineering. Essentially, instead of using a synthetic spacer between the jaw bones, they would implant biological tissue engineered discs. This would be completely safe for patients as opposed to using the Teflon discs once used back in the 1980s, which were found to spread into the patient's brains. That concludes our presentation. We hope that we have provided a better understanding of temporal mandibular joint disorders. Thank you.